I am Dr. Shanta Kumari, working as an eye specialist, as chief physician in the Mada Ayurveda Eye Hospital at Trivandrum. And I have about 40 years of experience handling different types of eye disease on Ayurvedic basis. Now I am facing you to talk something about the Ayurvedic approach for the treatment of macular edema. There is a reason behind this, because the number of people searching Ayurvedic treatment for macular edema is increasing day by day. The reasons are many that I will come later. And any person who is searching this Ayurvedic treatment for macular edema, they know what is macular edema. They know it is a fluid accumulation and the layers of retina is behind the retinal layer. And retina, everybody knows, is the innermost nervous layer lying inside the eyeball. And macula is the most sensitive area of the retina where the light rays converge. And it is responsible for the sharp vision and the clear vision. So any defect or any pathology of this area means macula, directly involves and directly affects the vision. That is the importance of this disease. That means any person who is having macular edema, they will be suffering from visual problems. Doesn't mean that just pain or watering, redness, not like that. There will be considerable defects in the vision. So at present, the main treatment procedures for this is said to be some laser treatments or intraocular injections like that. So in my experience, many people are afraid of these methods. So many people are asking me that I have macular edema and I have been under treatment for this for the last 1 year or 2 years like that. And the doctors say the intraocular injection, that means an injection inside the eye, is the only method for the treatment. And that also there is no complete cure. So they are asking me, doctor, whether there is any treatment for this in Ayurveda, or at least can I avoid this injection inside my eye? I won't prefer any injection in my eyeball. So whether you can protect and avoid the injection inside my eye. So these questions are from many people. That is why I am trying to talk something about this at present. There are methods in Ayurveda to prevent this injection, because we know it is a fluid accumulation in the eye. So in Ayurvedic method, the main aim of the treatment is not to drain out the accumulated fluid. It is not like that. In Ayurveda, we are trying to maintain the circulation and trying to avoid the accumulation of fluid in the eye. That is the main aim. So the possibility of accumulation, possibility of some deposits inside the eye should be avoided. This is possible in Ayurveda. For this, a simple eye drop inside the eye is not at all recommended. It will not give any desired results. We have to start from the basic reason. Actually, diabetes also is a contributing factor, stress is a contributing factor, and there are so many food dietary factors which is influencing. These are all these factors we have to consider. But first of all, I am focusing on the treatment line. So we have to, in Ayurveda, we are trying to avoid this accumulation by two methods. One, to take internal medicines so that their circulation of the blood and the other fluid system is bringing to normal, so that there is no accumulation, no congestion of the vessels, and so there is no fluid accumulation anywhere in the. So there is some particular group of medicines are having the properties anilomana. That is a very important term in Ayurveda. That means which will keep the flow normal. So that type of medicines should be taken internally. And another important section is external treatment procedures. It should be started from the head region. So many procedures are there. For example, Shirodhara and Shirolebanam and Shiro-Uddhartanam, like that. All these are for different purposes. To stimulate the nervous functions, to dissolve the accumulated particles, and to maintain the circulation. For different purposes, we will select different medicines to achieve this procedure. And second method is medicines in the eye. That also should be done in the 2 stages. One is to drain out the already accumulated things. Second is to stabilize the retina so that further damage will be avoided. And to improve the nervous function and to improve the nervous layer of the retina. By these methods, we can protect the retina. Side by side, by internal medicines, the normal circulation also will be maintained. These are the methods in Ayurveda. So, people who are suffering from macular edema need not be afraid. And they have already treated hundreds and hundreds and hundreds of people suffering from this method. By this method, they are getting good result also. So it doesn't mean that one treatment for 1 week or 2 weeks will be enough for the whole period. It is not like that, because if the causative factor, for example, if the person is a diabetic patient, just like we have to control diabetes by continuous medication, we have to keep in mind that the macular edema also should be maintained by some simple methods. Maybe sometimes one oil on head, maybe sometimes one eye drops. Like that, we will have to continue to avoid further damages. By these methods, we can protect. And second thing is dietary factors. Here also, we know diet is the main influencing factor for any pathology, because everything happens, any functions in the body is maintained by the food we are taking through diet. So it should be selective. Generally speaking, I can say any food item which is hot and spicy or too much sour tasted will be generally a contributing factor. It will trigger the condition. So it is better to avoid. But a full diet chart can be given to a person only looking into the total diet habits of the patient. Then only if I get the total diet, what all things, what all fluids he is taking, and about to think of the other systemic disease also, then only I can give it a complete diet chart. So, in general, we can say with this macular edema is controlled by 3 things. One is the medication inside the eye. Second is the treatment procedures extra-ophthalmic. That means other than eye. And third is medicines and also including oral things, diet habits and also other internal medicines. By these methods, we can protect the vision and we can avoid the intraocular injections and further attack of macular edema. Okay, then I am Dr. Sandhamari, who has shared my experience about the treatment of macular edema.